Welcome everyone. I'm excited to welcome you to today's presentation. Today, we're focusing on the Prometric MCQ of the day for Qatar nurses. The title of our session is Qatar Prometric MCQ 2025. Must know 10 questions, with explanations to help you understand each one better. Over the course of this presentation, we'll go through these 10 key questions that you absolutely need to know for your exam. Let's get started and make this session both informative and engaging. Alright, so when it comes to intramuscular injections in adults, choosing the right site is crucial for both effectiveness and patient safety. The correct answer here is the ventrogluteal site. This site is widely recognized as the best location for IM injections in adults because it offers several advantages. For one, it's a safe zone that minimizes the risk of hitting major nerves or blood vessels. It also provides a thick muscle mass, which helps ensure the medication is absorbed properly. Plus, it's less likely to cause discomfort or complications compared to other sites. So, understanding why the ventrogluteal site is preferred helps us deliver injections more confidently and safely, which aligns perfectly with our overall goal of providing quality patient care. Now, when considering the best site for intramuscular injections in adults, there are several options to keep in mind. The deltoid muscle is commonly used, especially for smaller volumes, but it can be limited in the amount of medication it can safely hold. The vastus lateralis, part of the thigh, is another option, particularly in certain populations like children, but it's also suitable for adults. The ventrogluteal site, which is located on the side of the hip, is generally considered the safest and most preferred site for intramuscular injections in adults because of its distance from major nerves and blood vessels. Lastly, the dorsogluteal site, located in the buttock, has historically been used, but it's less favored today due to higher risks of nerve injury and the presence of the sciatic nerve nearby. So, to connect this to our overall theme, choosing the right site ensures both effectiveness and safety for our patients. And the correct answer here, highlighted in green, is the ventrogluteal site, making it the best choice for IM injections in adults. Let's talk about why the ventrogluteal site is considered the safest for adult injections. First, it's away from major nerves, specifically the sciatic nerve, which reduces the risk of nerve injury during administration. This makes the site safer and more reliable. Additionally, this area has a lower risk of injury overall, which is crucial for patient safety. Another important point is that the ventrogluteal site can accommodate larger volumes of medication, making it suitable for medications that require bigger doses. Plus, compared to the dorsogluteal site, the ventrogluteal has less fat tissue, which actually helps with better absorption of the medication. All these factors, safety, lower injury risk, capacity for larger doses, and better absorption, make the ventrogluteal site the preferred choice for intramuscular injections. This aligns with our overall goal of ensuring safe and effective medication delivery. Let's walk through how to locate the ventrogluteal site. First, place the heel of your hand on the greater trochanter, which is the bony prominence on the side of the hip. Then, point your thumb toward the groin area. Next, extend your index finger toward the anterior superior iliac spine, which is a bony point at the front of the hip. Your middle finger should be directed toward the iliac crest, the top border of the pelvis. When you connect these 3 points, they form a triangle. This triangle is your ideal injection site. Remember, accurately locating this area is crucial for safe and effective injections, helping us avoid nerves and blood vessels while ensuring medication delivery into the muscle. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a moment to review some of the specific injection sites and their recommended uses. First, the deltoid muscle is primarily used for small volume vaccines. This makes it ideal when only a small amount of vaccine needs to be administered. Next, we have the vastus lateralis. This site is particularly good for infants because of its accessibility and safety profile. While adults can also receive injections here, it's generally not the preferred site for them. Then there's the dorsogluteal site. However, it's important to note that this site is not recommended anymore. The main concern is the risk of injury to the sciatic nerve, which can lead to complications. When comparing these sites, always consider the patient's age, the volume of the vaccine, and safety factors. Choosing the appropriate site is crucial for effective and safe vaccination, and understanding these differences helps us make better clinical decisions overall.